Create with France Sydney. Hello everyone and welcome to the show. This is episode 64, so welcome to Create with France. You might have noticed that we are talking a little bit more about food and how this is connected to changing our life, creating the life that we want through improving many aspects of our life. And today we're going to talk about how the diet that we have influences our mental health. And just to tell you that next time we're going to talk about why I cannot lose weight. And this is one of the things that makes our life really difficult. Being very anxious about food, maybe overeating, maybe even doing too much of exercise, being too restrictive and still not losing the weight. That is the time to talk about what is the psychological reason why we're not losing the weight. But just to stick on the topic for today, I've been really inspired by so much publication and medical studies and TED Talks, and I just want to share with you all how to have a very simple improvement in our life that will make our life better by lowering our rates of anxiety, of depression, and even having an effect of autism and bipolar disorder. How is that possible? Well, stay tuned to find out. And let's get started. Which is really not about my opinion, but really a collection of so many medical studies and so many experts talking about the topic, which you will notice in the last 5 to 10 years. Everybody's talking about the connection between the gut flora and what we are having as a food to create a good one, but also how this will affect our mental health. And I'm going to quote extensively from a PhD professor of clinical psychology at the University of Canterbury in New Zealand. She's actually from Toronto, but she is trained in neurobiology and clinical psychology. So I think, she's way more trained than me and possibly most of you guys listening to me. Her name is Julia J. Rucklidge. And her talk on a TED Talk YouTube channel is linked below in the show notes. If I remember to do it, I don't know yet, but I hope I will remember to do this. So Julia has done so much work and she is very interested in nutrition and in mental illness because she has been studying for many years why lots of children that have psychiatric illness were receiving conventional treatment, so lots of medicines for ADHD, bipolar, but they were not getting any better. Actually, they are getting worse. So she spent 6 years, that was back in 2014, studying nutrition. And I thought that was very interesting, to see what's going on. It was a very interesting way of getting out of a medical model of just giving a pill to fix the behavior. And if you are looking to change in your life, and not only in your family, but at work, in all your activities, feeling better, one of the big things is to look at why you are feeling that way. And we don't realize that sometimes, very simply, our nutrition is making things very, very difficult. So we can't sleep, we are more anxious, we are more tired, we have mood swings. And sometimes what we need is not a pill with some very special psychotic medication, but just to change the way we look at food. So if it is something of interest, keep listening because we have so many studies, so much to talk about. It is going to help you to look at food with a different point of view, really. So the TED Talk with this doctor just starts talking about lots of health surveys, talking about psychiatric illnesses that actually doubled in the last 5 years. And she said that internationally, we have 3 times more ADHD cases, 20 times more autism, 40 times more bipolar. And also there is a 4-fold increase of people, how many people are on disability because they have a psychiatric illness. And she said, well, nowadays what doctors will do, they give you a psychiatric medication, then they might give you psychological therapies. And that, of course, if you get to be, in the line to actually see someone when, maybe in many, many months. So a lot of people go private, so they actually get help now. And she was very worried about how many people, 500,000 New Zealanders, that's 1/8 of them, they have been prescribed antidepressants. And that's almost 40% higher than 5 years previously. And not only that, but all the antipsychotic, they just doubled. And so she's thinking, okay, these are treatments that can save lives. If a person is in really big trouble and had just a really big event and nothing else is happening, one-off, of course, give them this pill. But is this something that we should take for life? And is there something that can help us here? And so she's not dismissing the possibility of saving somebody's life as a one-off. But she's saying that surely if these treatments are really effective, then shouldn't the rates of disorder and disability as a direct consequence of their illness be decreasing rather than increasing? But no, they're not, because in the short term, lots of treatments are very effective, but in the long term, they aren't. They're making life worse. And this is based on the data. What do you expect with a PhD professor talking? That's how it is. It's getting worse. What can we do about that? There are so many aspects of the solution. One is, of course, looking at what is actually going on. So in all these medical studies that this doctor is talking about, we have, for example, ADHD children who are treated with stimulants, with Ritalin. So in the short term, you see, well, yeah, they're responding, they're much better. But in the long term, the studies show that they're not doing as well as those who did not take those medications. And also antidepressants, aren't we all increasingly using so many of them? But the recovery rates, the relapse rate are not better than 50 years ago when we did not have these medications. And the worrying stuff that she's really concerned about is that when we treat children who have depression with antidepressants, they are 3 times more likely to convert to bipolar disorder compared to those children who didn't. So is there something that we're missing here? She's very interested in seeing this connection, and I thought that she was really correct. We can't just give antipsychotic medication, because when you look at the studies, we are saying that there's a quite big picture that there is no long-term improvement. And she talked about an important person, Professor Bonnie Kaplan, who was her PhD supervisor 20 years ago. And she was saying, well, we have some people in Canada, in southern Alberta, who had bipolar disorder, they had psychosis, and they had depression. And these are very, very serious conditions. And so this PhD supervisor, being, of course, educated in clinical psychology, had been taught that only drugs could help with treating these serious conditions. But they were publishing more and more data, more and more study, showing that people, to get better, they were actually treating themselves with a different type of nutrition and with very, very good high-quality nutrients. And so, this doctor said, this is so interesting. And she decided to do a randomized placebo-controlled trial using minerals and vitamins. We just call them micronutrients. And she decided to do this in 2009 to treat adults who had ADHD. And this study was actually published in British Journal of Psychiatry in April 2014, so you can go and look it up. So there was this study, and within 8-week period, twice as many people responded in the macronutrient group compared to the placebo group. And twice as many people went into remission in their depression in the micronutrient group. Wow. And then she noticed in these 8 weeks the hyperactivity, the impulsivity reduced to a normal, non-clinical range. So these people were fine, those who were taking the macronutrients. And their symptoms were not impairing their life so much, they're not interfering so much. They were a lot better compared to the people who were on the placebo. And then the study went later on to look at these people a year later. They kept improving. They didn't go backwards, but those who switched back to their normal ADHD medication, they're actually getting worse with their symptoms. So, of course, she wants to make sure you know that macronutrients are a lot more than those vitamin pills you can buy in a supermarket. So we're talking about medical grade and high quality. And that's very important to know that, just a little bit, a few grams of this and that is not going to be just enough. And she is talking about 20 papers published in medical journals that are all documenting the benefits of these macronutrients. And I give you a little hint, they are not contained in takeaway foods. This doctor continues to say that in the study they showed that they reduced the symptom of bipolar disorder in children by 50% while reducing their medication. Now to think about it, they reduced the rates of PTSD from 65% down to 18%. This was just following the Christchurch earthquake. Then they were just done with 1 month of macronutrients. That was amazing. They studied these people a year later. The people who had the nutrients were doing a lot better than the others. And this study has been replicated with other people who worked on other volunteers who were given a lot better nutrients than you can ever find in a supermarket. So the message after all these studies and all this research is that a well-nourished body can cope a lot better with all the stress, with recovery from illness and all the rest. So it is very effective, very inexpensive as a public health intervention. And she sees dramatic responses that are very, very good. And she says when these people are taking those supplements, they get well, but they don't just get well in their anxiety, in their depression. No, they get well across the board. The symptoms are just getting better and better. They sleep better. The mood swings are gone. The anxiety is way more reduced. They don't even need, like before, so much alcohol or cannabis or cigarettes. And about 60 to 80% of people do respond so well to macronutrients. And so now she's talking about 20 randomized placebo-controlled trials, which is just the gold standard when doctors make clinical decisions. And they show that when you give those macronutrients, you can reduce your aggression in prisoners. You can help people with their cognitive decline when they're becoming older. You can treat depression. You can treat anxiety, ADHD, autism, and stress. So you think about it, we have all these people that have these problems and we have this decline in our mental health. But we have so many studies showing that if you just get these very, very good macronutrients, things can get a lot better and a lot faster. And it's very cost effective. And one of the documents was very good. It was showing there was a 10-year-old boy that has psychosis. And after 6 months of a normal medical treatment with psychotic psychotic medication, that was not successful. And so they were giving him macronutrients. Well, not only they completely eliminated his hallucination and his delusions, but after 6 years, he still was good. And the cost of the treatment was just not even 2% of the cost of giving him those expensive medications. And the studies are showing also that when we start the supplements before the mental illness comes, so if we have these micronutrients in our body before becoming ill, we can stop the problem from developing in the first place. I think that this is amazing. In one fantastic study, they took a group of adolescents and they gave omega-3 fatty acid in the form of normal fish oil. Yes, fish oil is an important thing. Yes, I know, it smells not very nice, but they're very, very important for the health of our brain. Well, these adolescents for 12 weeks were given omega-3 fatty acid, and a year later, they showed that they had an 80% reduction of the chances of these people converting to psychosis. I mean, that's quite a thing, isn't it? So of course you might think, well, why don't we just eat better? Because these macronutrients are somewhere. Yeah, and why doesn't the government tell people to eat better? Of course, because we know, if we look around, there's so many hundreds of studies, there is such a relationship between the patterns of our diet and our mental health. So we can change, right? We can change. And we can look at, maybe if we cannot have the supplements, what she's suggesting and what so many scientists are suggesting is to eat a very prudent diet, an unprocessed type of diet, or a Mediterranean type of diet, the one that we had maybe 20 years ago in Italy, that everybody had, a very simple, not processed. And this will automatically lower your risk of depression. And of course, it's quite obvious that the more we eat a Western type of diet, full of processed food, the higher our risk of depression is. Now, being Italian, I should have quite a clue what a good Mediterranean diet is. I think I remember making some ravioli a couple of months ago and thinking, yeah, that sounds so good. I can't do them all the time, but there are ways of doing a very simple choice every day and choose non-processed food as a main food every day. So you might ask, what is the Western diet? It's just a diet that is full of heavily processed food, very high in refined grains. Maybe you have sugary drinks, maybe you have often your takeaways, maybe you don't have much fresh produce every day, while the healthy diet will have a lot of fresh fruit and vegetables, a lot of fish, nuts, healthy fats, and very, very few processed food. That's very simple. You don't have to go mad. Basically, if you present this food to your grandmother and she doesn't recognize it as food, you know that there is something wrong with it. So there are, of course, lots of things to think about why all these foods cause problem to us. And the main thing is that they cause inflammation. And when our gut is inflamed, we cannot absorb the nutrients. So you have to be very, very careful what you're eating. It's an individual change we can do, it's a collective change. And this is how you change your life. When I say create your life, I'm not talking about becoming rich, becoming a millionaire, and being on TikTok and be very famous. No, I'm talking about changing from the inside, feeling good about yourself and improving your health with very, very simple decisions that you can make. So when you prioritize your lifestyle factors, you choose healthy eating, you choose exercise, you choose maybe those supplements that are good in your own particular case. And when you need psychological treatments, yes, have them. But say those medications when all of these approaches have not worked. In long range, you can see, well, nothing is working. I need something stronger. I'm going to talk to somebody because the therapist cannot find out anything wrong with me and nothing has worked. My diet is perfect. Of course. Just make sure you don't, sweep away these ideas about nutrition, because nutrition is so important. When you are thinking about not having a heart attack, you will start waiting, not for the heart attack. When you go to the supermarket and look at those foods that is going to help you so that you will not have heart disease. And it's the same for mental health. So you want to tell women who are pregnant to remember to eat well. If it's not possible, if you need some help, we have to tell, because if you are nutrient depleted, you're going to have children that are born with problems because the minerals are not there that they need. The right hormones are not there. And so a nutrient-poor food during your pregnancy will increase the chances that your own child will have a mental health problem later on. So it's important to learn about the risk of this cheap and processed food. I mean, we're calling them cheap, but cheap food is really an illusion. There is no such thing as a cheap food, isn't it? Quoting here from Michael Pollan, the price of cheap food is paid somewhere. Maybe you're not paying it when you're buying it, but then maybe something goes wrong with the environment because of that. Maybe there is something that will have to help you from the public money because your health is not good, because you're only eating this cheap food. It looks very good, it tastes very good, but it's not good. And this is why I think it's so important to teach our children how to cook from scratch, how to grow food, how to recognize that there is a connection between us and nature. And food doesn't come in a packet. And so what is in your lunchbox? Is it full of, I'm not going to mention any of the food, but is it full of stuff that if you throw it on the floor, you're going to get moldy? Well, it's not very good. Yes, I know that even an apple will get moldy, but the seeds will create something else. Try to do that with a pack of cereals. It's not going to happen. Try to do that with crisps. No, we're not a potato anymore. We've been so processed. And so if we keep rewarding our children and the students and people who have birthdays with processed food, we reward this good behavior with bad stuff. That makes no sense whatsoever, doesn't it? So when we eat something, we're making a choice. We're eating something that is nourishing or something that is not nourishing. Maybe the concept of eating good food to prevent mental health issues is very new to you. I'd have to say that this doctor of a TED Talk, she was very good because she remembered that many, many years ago in the 19th century, when people were dying of infection really fast, there was a doctor called Dr. Semmelweis, and he said, well, we should really wash our hands when we go and help mothers to deliver the babies because we are passing infections. Nobody listened to him. He was censored, he was criticized, he was put down, he was treated like a complete idiot. We're like, why are you kidding? We're not passing anything to our babies and our mothers. Just be quiet. And 2 years later, he died of septicemia, another problem, that could have been prevented. Why? Because in the 19th century, nobody would ever believe that infection could be caused by not washing your hands. And now we take it for granted because we have learned from experience that washing your hands is a very important thing when you are treating somebody in the surgery, at the doctors, etc. Do not expect the government to tell us to eat properly, because that's not really their job. I mean, many times in the 1600s, there were studies showing that you need to give limes to the mariners that were away on a boat for months on end. And that was going to cut 40% of mortality from scurvy. But the British government took 264 years to mandate that all the ships must carry citrus for their sailors. So, do you think we have to wait to be told that we should pay attention to the research that is telling us day after day, and it's been telling us for 20 more years now, that if we're not having the nutrients, we're going to have an epidemic of mental illness? Wait, it's already here. So it's important to get ready about this mental health. Why? Because it's affecting all of us. We have so much anxiety, depression, sleep problems, ADHD, autism, and a lot of this is not just part of a problem that we have maybe in our family with things that are going on. It's just the food that we're eating, and we can get things so much better. So if we are struggling with anxious thoughts, with fears, sometimes the real thing that we should be careful about is what we are eating. Because junk food, processed food, refined sugar, and certain types of medication and certain type of low-quality supplements may have a very bad impact on our gut flora. And then the connection between the gut and the brain is hampered. America's pharmacist Suzy Cohen wrote, she's a pharmacist, right? She wrote a big article about which medication can spark anxiety, and it's quite a good list, and how our mental wellness can be very much improved by improving the gut flora, and how this connection is so important for us. And we have to remember that unstable moods, anxiety, lack of sleep might as well be caused by, very simply, lack of nutrients. So we have to be able to not underestimate what is going on in our body, what the bacteria are doing. And we know that it's very easy to just get a pill to enhance our mood, or get a cigarette, or tell everyone that we're ill and we can't get out of bed. And it's so easy to just dunk something that is bad for us. And it's easy just to blame others for everything. But it's important to take responsibility and start thinking, wait a minute. Yes, I know that in my family we have issues, so I'm anxious and I'm depressed because of X, Y, Z. But am I helping myself with the real food, with live food? Am I doing that? And if not, what is stopping me from doing it? I will be putting links below so you can read and listen to this TED Talk, look at the articles if you're interested at all, in maybe making a good improvement in how things are going on for you. Because I fear that lots of us are not really giving enough credit to good foods for how they're feeling in their emotions and in their tiredness and in all sorts of things, how alert we are, how able we are to concentrate, our mood swings. So let's give it a go. Maybe now that we are, getting closer and closer to Christmas, we can really start thinking about just how many takeaways are we having. Can we cut them down to a third? Can we cut them down to half? Because it is affecting us. And, as a result, this is going to be such a great investment. A lot of people think, I cannot afford to do this, I cannot afford to do that. And yet they spend their time and their money in lots of stuff that is going to cost them a lot more in the long run. Just think about it. What can you save by getting your treatment earlier? What can you save by treating your anxiety now? By sleeping well, by eating well, by performing better at work. So it's still an investment in yourself. And we all deserve to invest ourselves and in ourselves, in eating well and in having good thoughts patterns, in really looking at the consequences of what we're doing in how we're feeling. You deserve it. You deserve to create the life you want, and you can create the life you want in the moment you take responsibility and you allow yourself to eat what is right for you, for your body, for your constitution, for your diet, for your financial resources, and for your routine. We all deserve to feel better, and it starts with what we put in that plate every day. So this is my challenge for this week, and next time we're going to talk about those who've done everything. They are basically saints, they've done everything, but the weight is still attached to them and it's making them really, really suffer. So thank you so much for being with me today. It's been a pleasure to talk to you for almost an entire half an hour about the connection between food and mental wellness. I will talk to you soon. Please share and maybe talk about these topics with your friends so that more people can know about how to create the life of your dream and improve anything that is not going too well at the moment. Take care. Bye-bye. You've listened to Create with Fran Sidney.